first student nurse today. I'm from Peripheral A&M University. And today I'm going to be assessing your thorax and lungs. I'm going to be assessing your cardiovascular system, your peripheral vascular, and your abdomen. I'm just going to ask you a few questions if that's okay. Okay. Do you have a cough right now?
No, ma'am.
Do you have any chest pain?
No, ma'am.
Do you have any chest pain when you're breathing?
Sometimes.
Do you smoke?
Yes.
Do you have any shortness of breath?
No, ma'am.
Do you have any abdominal pain?
No, ma'am.
Have you been nauseated or vomiting recently?
No, ma'am.
And do you have a history of high blood pressure?
No, ma'am.
Okay, good. So first I'm just going to assess the posterior side of your thorax and lungs, which is the back. So I'm just going to inspect it first. Is it okay if I pull your shirt up?
Yes, ma'am.
Okay. So the color is consistent, no redness, no lesions. Put your head down to your chin down to your chest, and I'm just going to feel down your spine to make sure that it's straight. Okay. So your spine is straight, your thorax is symmetrical, your scapula are symmetrical. Next, I'm going to check for your lung expansion. So I'm just going to place my hands down here by your ribs. Your ribs slope at a 90-degree angle. So for your chest expansion, I'm just need you to breathe in and out. Okay. So chest expansion is symmetrical. Next, I'm going to palpate your posterior thorax. Just let me know if you feel any pain or tenderness. Okay.
Yes, ma'am.
Any pain or tenderness?
No, ma'am.
Okay. Now I'm going to palpate for your tactile extremities. So I'm just going to place my hand over your back, and every time you feel my hand in a new spot, just say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, so tactile extremities is symmetrical and dominant. Next, I'm going to percuss for any resonance over the lung fields. So I'm just going to tap my finger over a couple areas of your back, and you can just breathe normally. Okay, so resonance is dominant over the lung field. And next I'm just going to auscultate for your breath sounds over your lungs. So I'm just going to ask you to take a couple deep breaths through your mouth as I move around in each spot, okay? And is it okay if I lift your shirt again?
Yes, ma'am.
Okay. Warm it up. Okay. Breathe in and out. Okay. So vestibular breath sounds are clear. So next I'm gonna assess your anterior thorax. So if you could just turn and face forward for me the other way. Okay. So is it okay if I lift your shirt up for you? Okay. The anterior thorax is consistent with color, no redness or lesions. Belly button present, umbilical. There's a scar noted. And it's symmetrical. Okay. Now I'm going to, if you could lift your arms up for me, I'm just going to see what's the anterior to transverse diameter on your body. Okay, so it looks about a 1 to 2 ratio. Now I'm going to inspect the slope of your ribs. So I'm just going to, sorry. Okay. So for your ribs, I'm just going to see if they slope downward. So if you could place your arms like just to the side or to the front. Okay. And your ribs slope downward with the spine at a 45-degree angle. Now I'm going to check your pulse. And your radial pulse. You can just breathe normally and give me about 30 seconds. Okay. So I was actually checking your respirations, which is your breathing. And your respirations are 18 breaths per minute. Now I'm going to palpate your anterior thorax for any tenderness or pain. Okay. So I'm just going to feel on this. Okay. So look up for me. Sit straight up. Okay. Just tell me if you feel any pain or tenderness. Okay. Any pain or tenderness? No pain, no tenderness. And next I'm going to percuss over the anterior thorax. So I'm just going to tap and listen for resonance over the lungs. So just sit straight up for me. So resonance is dominant over the anterior thorax. And next I'm going to auscultate. Listen to your breath sounds again from the anterior position. Okay. So if you could just take deep breaths for me every time I move to a new location. I'm gonna need this soup. That's okay. 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 In and out. Okay. So vesicular breath sounds are clear. No adventurous sounds were heard. And that's it for thorax and lungs. Next assessment is going to be your cardiovascular system, and this is going to be your heart and your neck vessels. So first I'm just going to inspect your neck for any pulsations or the color is consistent. Oops. No bounding pulsations. Internal jugular pulsations are present. Okay. And next I'm going to auscultate your carotid arteries. So if you could just what I'm gonna have you do is inhale, exhale, and hold your breath. And turn your head to the left for me. Let me get this one. Okay, and let your breath in. And I'm gonna do it for the other side. Inhale, exhale, hold. Okay, so now carotid root was present bilaterally. And next I'm going to palpate your carotid arteries. So I'm just going to feel for them. So just tilt your head to the left for me. Okay, and the other way. Okay, so carotid arteries felt bilaterally. And next I'm going to inspect your pericardium, which is around your heart. It's okay if I lift your shirt up again? Okay. Usually you'll be in a supine position, which is on your back in 30 to 45 degrees, but for this we're just gonna do it like this. Okay. So no visible pulsations, color is consistent. And next, assess a few areas in your heart for thrills. So I'm going to start with the aortic at the second intercostal space. Pulmonic at second intercostal. Herbs at fifth intercostal. Mitral at fifth intercostal. And I don't feel any thrills present. Next, I'm going to palpate your apical post. And okay, so that's going to be at the fifth intercostal also. Okay, so it is a gentle tap. It feels about 2 centimeters. So next I'm going to auscultate for your breath sounds in your heart. So I'm just going to go the same direction with the areas that I was just checking. Okay. So first I'm going to listen with the diaphragm to listen for the rhythm of your heart and your S1 and S2 sounds. So you can just breathe regularly. Okay. And I'm going to start with the aortic. Then pulmonic. Herbs. Mitral. And then apical. So S1 and S2 sounds were heard in all areas. Your rhythm is regular and it sounds like your beats per minute are about 60 to 100, which is expected. So the last thing I'm going to do for the cardiovascular assessment is use the bell of the stethoscope and make sure you don't have any extra S3 or S4 sounds or murmurs in your heart. Okay, so I'm just going to go to the same area that I just went.
Oh no. Oof. Okay.
Ready?
Mm-hmm.
Herbs at third intercostal. Mitral at fifth intercostal. Apical. Okay. So no S3 or S4 sounds or murmurs were present. And that sums up the cardiovascular assessment. Okay. So the next assessment I'm going to be performing is over your peripheral vascular assessment. So first if you just hold your arms out for me, it's basically just gonna be like head to toe. So first I'm gonna start with your upper extremities. So straight out. Okay, so I'm gonna just inspect your arms and your hands. So your arm color is consistent. There is hair distribution present. Your hands, the color is consistent with your ethnicity. And I'm gonna palpate for any swelling or in the temperature. That's okay? Okay. Okay. So there's no edema present and it is warm to touch. So now I'm gonna inspect your fingers. I'm gonna inspect them for clubbing, which is like of the fingernails. So if you could put your nails like this one at a time. This hold it up so I can see it. Okay. So there's no clubbing present. And let me palpate them, feel on them for any swelling, temperature. No swelling present, and they are warm to touch. So now I'm just gonna test your capillary refill. So put your hands out like this for me. And I'm gonna just squeeze your nail beds to make sure they go back to the first color. Okay, so your capillary refill is less than 2 seconds and there was no edema present. Now I'm gonna check both of your radial pulses at the same time, so just hold your arms out for me. Okay. Radial pulses are 2 plus bilaterally. Now I am going to inspect your legs. So if you could just hold your legs straight out for me. Okay. So the color is consistent. Hair is distributed among the legs. Doesn't look like any edema is present. It's okay if I palpate, feel on them. Okay. I'm gonna just feel for any swelling and the temperature. Okay, so there is no swelling present and the legs are warm to touch. And now I'm going to inspect your toenails. So you could take your socks off for me, please. Your socks, please. I'm gonna inspect your toenails and your pedal pulses. So your toenails, it doesn't look like any clubbing is present on your toenails. And I will put on gloves, and then I'm just gonna inspect. I'm gonna test your capillary refill. So the same thing I did with your hands. Okay. So your capillary refill is less than 2 seconds. And now I'm just going to check your pedal pulses. So I'm going to start with the dorsalis pulse. Okay. And now I'm going to check the posterior tibial pulse, which is in the back. Okay. And both pedal pulses are 2+ bilaterally. And that's it for the peripheral vascular assessment. Okay, so the last assessment we're going to do is going to be for the abdomen. So first I'm just going to inspect it. So the abdomen is flat, color is consistent with ethnicity, there's a little hair distribution, there's a umbilicus present, it's midline and introverted. Okay, now I'm going to auscultate your bowel signs. So I'm going to start at the right lower quadrant and just go clockwise. And you can just breathe normally. Okay. So bowel sounds are active in all 4 quadrants. Now I'm going to percuss your abdomen. So I'm just going to tap on it and just let me know if you feel any pain or tenderness. Okay. So, was there any pain or tenderness? No pain or tenderness. And tympany is predominant over the abdomen. So next I'm going to palpate your abdomen. So first I'm just going to start with some light palpation. And just tell me if you feel any pain. Any pain? Okay, so the abdomen is soft, no pain or tenderness reported from the patient. And next I'm going to do some deep palpation. So I'm just going to go a little deeper. Pain or tenderness? No pain, no tenderness noted. No enlarged organs, and no masses were felt. So that's going to wrap up the assessment for today. Do you have any questions?
No, ma'am.
Okay. Great. Thank you.